Hi. Sorry, did I startle you? When you're used to hearing a certain type of commercial, something like this can, well, take you by surprise. That's kind of how it is with the Lexus RX, a vehicle that has continued to defy expectations for over 25 years. From the first luxury vehicle of its kind, to the first hybrid luxury vehicle, to the only plug-in hybrid worthy of the RX name. We understand you want more than the everyday SUV. And isn't being understood an amazing feeling? Click the banner to discover more. Experience amazing at your Lexus dealer.
It's last call for football on FanDuel, with one last round of rewards every day through Super Bowl 60. One last week for one more chance. Visit the FanDuel app all week long for limited time boost every day until football runs out. FanDuel, official partner of Super Bowl 60.
New customers bet $5 and get $200 in bonus bets if you win. 21 plus and present in select states. First online real money wager only. $5 deposit required. Bonus issued as non-withdrawable bonus bets which expire 7 days after receipt. Restrictions apply. See full terms at FanDuel.com/sportsbook. Gambling problem? Call 1-800-GAMBLER or visit rg-help.com.
Okay, does this happen to anybody else? You sit down with a juicy QPC, some McNuggets, and those golden fries from McDonald's. Then you take a long sip of your Sprite because you can still hear your mama saying, "Don't fill up on that drink before you eat your food." But you're grown now, so you do what you want.
Share and share alike with the 20-piece McNuggets from McDonald's for just $6. Limited time only. Price and participation may vary. Cannot be combined with any other offer.
Ba-da-ba-ba-ba.
Sling is the live TV service that puts you in charge. Choose your plan. Orange for sports and entertainment favorites, blue for news and reality, or select for the essentials. Only pay for the stuff you actually watch. And pause your subscription anytime because paying for TV you're not watching? Well, that's just rude. No long-term contracts, no nonsense. Pick your plan, add what you want. Sling lets you do that. Visit sling.com to learn more.
It's no secret that the U.S. has been facing a shortage of primary care physicians that's only expected to worsen in the coming years. Despite some proposed solutions like giving more responsibilities to nurse practitioners, accessing your local physician continues to be a big issue for many people.
In a lot of cities, including my city, Portland, the wait times for primary care are through the roof, and they've only gotten worse after COVID. And so you might see 6-month wait times. When you go see a physician, you might have to wait a long period of time to make that appointment or to make follow-up appointments. When you do go see them, you might not see them personally and be limited in terms of your time. And so you have to fit in lists and lists of healthcare concerns in a 15 or 20-minute visit.
That's Dr. Jane Zhu, a primary care physician and associate professor of medicine at Oregon Health and Science University. These significant barriers to care have carved a path for two alternative models to rise in popularity: direct and concierge primary care.
They are really focused on like sort of a monthly or annual fee. In direct primary care, this is a model where patients typically pay a monthly or annual fee, around $50 to $100 per month, without the physicians then billing insurance for routine care. So this is a model that operates outside of the insurance system entirely. And within that fee, you might have as a patient included in those services visits with your doctor, asynchronous texting or messaging with your doctor. There may even be labs or in-office procedures that might be included in that charge.
It essentially guarantees you quicker access to a physician than the traditional model. The concierge option is very similar, but Zhu says the fee is much higher, often in the thousands each year.
And it's more of a retainer model. So you're keeping a payment for the clinician in order to get better access to those doctors. And in the meantime, the doctors are still continuing to bill your insurance. So it is not operating outside of the insurance system. So the key differences are really one of cost and insurance use.
Zhu says these models have started to become popular with patients who want more personalized attention from their doctors. However, she warns against using the direct model as a way to completely bypass insurance. Between emergency room visits and specialist appointments, health insurance is still necessary. But with that said, she notes that some patients are starting to add direct or concierge care on top of their current plan to get the exclusive benefits.
They're choosing to pay an additional fee for improved access and although the direct primary care doctor or the practice doesn't bill insurance, those patients still have insurance most often as a fallback or for other types of care. So you could see, this is sort of a layered model where the direct primary care doctor is charging a flat rate, and patients like this because it may be affordable. They're getting more frequent care, more accessible care, but you still have to have insurance in order to access care outside of that practice.
Though Zhu herself isn't operating in one of these alternative models, she understands why many of her colleagues have made the switch.
There is obviously a ton of administrative burden. We're burdened by short visit times. There's always time pressure. There's administrative and management pressures. There's burnout in these traditional practices, including the ones that I practice in. And so for someone who is purely clinical, I totally understand the draw for these new models of care.
Concierge practices started in the 1990s and often cater to patients with higher incomes. Direct primary care, on the other hand, is slightly newer and more affordable, but Zhu says both have seen a larger growth in recent years. Her 2025 paper, published in the journal Health Affairs, reveals that the number of these practice sites has grown by 83% between 2018 and 2023. The number of clinicians participating in direct and concierge models has also followed this trend, increasing by 78% in that same timeframe. Zhu says one of the main draws for clinicians is the freedom these alternatives offer.
I'm not in a community hospital, but I work in a very typical academic setting where I don't set my own schedule. I don't set the length of my visits. I very much have my practice influenced by administrators, as do a lot of physicians in practice these days. And these administrators are often, they may not be making clinical decisions, the decisions that I make with my patients one-on-one, but they are molding the conditions and the settings in which I practice.
In addition to the greater autonomy, Zhu says having a flat fee instead of a fee-for-service structure helps increase the time physicians are able to spend with patients.
If a patient comes in, there's nothing more that I would want to do than to spend an hour of my time with them and to build that patient-doctor relationship, to address all the concerns they're coming in with. If there's anything acute, to take care of those issues. In our model, the traditional model of primary care practice, I have 30 minutes. Often that's a long visit. Sometimes, physicians only have 15 minutes to take care of a patient's medical issues. You might know that just being a patient, as we all do. And so if you have the control of your schedule, of how you write your documentation, of how you bill, of how you charge, then that, for a lot of these direct primary care doctors, these concierge doctors, they see that as a way to take medicine back from increasingly corporate and administrative oversight.
Despite this push, Zhu's paper shows that direct and concierge care models aren't creating as much separation as physicians may hope. A key finding of her paper reveals that during this same time period of growth for independent operations, corporate affiliated practices grew by more than 500%.
Corporate owners are increasingly owning these models of care, these practices, and potentially consolidating those as well. And so the reason this is, I think, worth noting and worth monitoring is because that might in and of itself change the philosophy and the incentive, the very basis of why these practices were formed in the first place as a response to these things happening across the healthcare system. And now that we're seeing that the same sort of ownership trends or the same organizational changes, structural changes might be happening in these groups of practices, I think that's worth monitoring over time because we want to make sure that despite those ownership models, or maybe because of those ownership models, we're not seeing changes in the way that clinicians are able to deliver their care, the pressures that they face, what they're charging, etc.
Along with tracking corporate influence, we need to continue to monitor where any cracks appear in this new system. While there's a lot of good that can come out of these models, Zhu says it's too early to really see the negative impacts.
For sure, some patients may benefit from having longer visits and better access, and physicians might actually stay in practice longer. They might have more professional satisfaction. They might have better autonomy. All of these things are really good. But when we look across the system, the healthcare system, what we need to keep track of and really monitor is whether increased growth in these membership-based care models could affect affordability or access for those that remain in traditional primary care.
A potential weak point is the workload of physicians. In traditional care, Zhu says clinicians can be responsible for up to 3,000 patients. Once they move to a concierge or direct care program, that caseload drops down to a couple hundred. It's great for those patients to have more personalized attention, but what about the thousands left behind to face the traditional system that's already experiencing a severe physician shortage?
So the questions that really come from these models and the growth in these models that we're seeing in the research is around scaling. What happens if you scale these models? We don't have enough providers to be able to provide everybody a DPC or concierge doctor. And so what happens to the patients who don't have the means or the ability to transition to these new models of care? One concern is that they will be experiencing even harder barriers with access to care.
Another main concern is affordability. Will access to quality primary care become something that's only available for those who can afford the retainer fee?
For everybody in the US to be able to afford a quality primary care provider probably requires a lot of structural change, both change with how we pay for services, where we pay for those services, and how we support our providers. All those things, anyone who's been navigating the healthcare system would be able to attest to the fact that that is not in place right now.
Zhu believes that as direct and concierge care models continue to expand, we also need to focus on building up the existing community-based programs that serve those unable to afford or access traditional care. You can find more information about Dr. Jane Zhu and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our executive producer is Amira Zaveri. I'm Elizabeth Westfield.
Okay, does this happen to anybody else? You sit down with a juicy QPC, some McNuggets, and those golden fries from McDonald's. Then you take a long sip of your Sprite because you can still hear your mama saying, "Don't fill up on that drink before you eat your food." But you're grown now, so you do what you want.
Share and share alike with the 20-piece McNuggets from McDonald's for just $6. Limited time only. Price and participation may vary. Cannot be combined with any other offer.
Ba-da-ba-ba-ba.
When it's time to scale your business, it's time for Shopify. Get everything you need to grow the way you want. Like, all the way. Stack more sales with the best converting checkout on the planet. Track your cha-chings from every channel, right in one spot. And turn real-time reporting into big-time opportunities. Take your business to a whole new level. Switch to Shopify. Start your free trial today